Hi, my name is Kathryn DelPizzo. I'm a pediatric trained anesthesiologist. I work at the Hospital for Special Surgery, and today we're doing a video for the HSS Annual Symposium. And we're going to be demonstrating pediatric regional anesthesia techniques. I'd like to introduce Trinity. She's our model today. Trinity's 10. She weighs 65 pounds, around 30 kilograms. There are a couple of points I'd like to make before we start, specifically about children. So children are 99.9% of the time going to be asleep before you do a block. And that is very safe. It's been tested over the past 2 decades. There have been large multi-center studies proving that its safety and efficacy. The second point that's very important is that you should know how to do these blocks in adults before you try to do them in children. The third point is that you must pay attention to local anesthetic toxicities. And we will show you a slide on that. But oftentimes in the adult population, you will not reach that maximum dose, but in children you often will. So before you do your block, you need to know the maximum dose you're allowed to use. In a child, the ultrasound is very, very important. It's much easier to see the structures, it's much easier to see the local, and it's much easier to see the structures you don't want to hit, such as the blood vessels in the lung. We're going to start scanning, and we're going to start with the Saphenous block. We use this for ACL reconstructions, even in children. We use it for foot and ankle surgery in children and adults, and in adults they use it for total knee replacements. So we have 2 different probes. I'm going to show you here. One is large linear and one is a smaller linear probe. Because Trinity is 30 kilograms, I'm going to use the small one. And so now I'm going to show you how we position the patient. The patient is supine here. You can have the leg in a neutral anatomical position. You can also laterally rotate the leg, and then some people will even bend the knee and do the block like this. So the probe, though, is going to be in the anteromedial mid-thigh position. So now I'm going to actually start scanning. So as you can see here, we have her femur, we have the vastus medialis, and we have the sartorius muscles. So those 2 muscles are the main landmarks that you need to see on the ultrasound to do this block. We have the femoral artery. You can see it pulsating there. The nerve itself is not always easily visualized in children or adults. We're lucky here. Trinity has a very nice saphenous nerve, and we'll point that out to you. When you don't see the nerve, you need to deposit your local anesthesia medial to the femoral artery below the sartorius muscle. In addition, you can see her femur very well, and that's because she's a child, she's small. You can actually get this all in one image. Sometimes when you're doing larger children, you do have to scan a little bit to see everything. Keep in mind that even though the saphenous nerve is a sensory nerve, sometimes the local can track up and it can numb the vastus medialis, which in that case you would have a partial motor block. So be careful when you're giving patients instructions after surgery. So now we're going to demonstrate the sciatic and the popliteal fossa. And this is one of the most important blocks that you need to learn in children because it's very useful for any lower extremity surgery. One of the most important points I want to make here is that you really need to know your anatomy. You need to know what your landmarks are. So they're the biceps femoris tendon laterally, and then medially it's the semimembranosus and semitendinosus tendons. It is also the popliteal crease. And the reason that's important is because any formula that you have learned from a book or from one of your teachers on adult patients may not apply to children. There's actually 3 probes that can be used for the popliteal block, and I'm going to show you the one that I prefer in small children. It's the linear probe. If you're doing a teenager or a larger child, you could use the curvilinear. You could also use the larger linear probe. Sometimes I don't even know which probe I'm going to use on a larger child until I actually look at the patient with the probe. But today I know that Trinity is small, and with her anatomy, I can just tell I'm going to need this linear probe. Right now, she's in the lateral position. The first thing I'm going to do is I am going to feel for her landmarks, and I know that her popliteal crease is here. I've also got the biceps femoris tendon. I've also got, on the medial side, the semimembranosus and semitendinosus tendons. A little trick that I like to use is that you take the intertendon distance at the crease, and then you use that distance, and usually you're going to find your nerve at that depth. Right now I'm going to show you how to do the popliteal with the ultrasound in the prone position. And to find the crease, oftentimes I will bend the patient's leg like this, and then you can let it go. The third position I wanted to show you for the popliteal block is if you don't want to move the patient lateral or prone, you can still do it supine. And one way to do it is to have somebody hold the leg for you, or sometimes what I've done is I've just put the leg here, and somebody often has to hold that because the patient's usually sleeping, and then you can just scan this way. But the easiest way is to have somebody hold the leg, and then you can do your scanning same way you would with the prone position or the lateral position. So what we're going to do now is we're going to look at the screen. I'm in the popliteal crease. There's the nerve and the popliteal artery. Now I'm in the crease. I don't want to block the nerve here. What I want to do is I want to follow this nerve up, and you are going to see these two nerves coming together. So you have the tibial nerve and the peroneal nerve. It's beautiful. You don't see this very often in adults. So we're coming up. We're going to see these two nerves join. That's where we want to block the nerve. So now we're going to talk about the infraclavicular block in children. You can use it for any surgery below mid-humerus and down. So you could use it for hand surgery or elbow surgery. One of the reasons that it's somewhat difficult in children is that the structures are very close together. So you really do need a small probe. We have the curvilinear here, we have the linear probe. Normally I love the curvilinear probe for the infraclavicular because you see deep structures better. However, in a small child, the structures are very superficial, like a centimeter. So sometimes it's better to use this linear probe. So now we're going to scan. So as you can see, Trinity is supine. It's really the only way that you're going to be able to do this block. And as I mentioned, I chose the linear probe. It's not my favorite probe to do an infraclavicular block with, personal preference. However, with Trinity here, her anatomy is such that you really need to have a probe for superficial structures. If you look at what we're doing right now, we're looking at the axillary artery. And if you look at the depth on our screen, it's barely over a centimeter. And below that is the lung. You can very clearly see the axillary artery. Below it, you can see the posterior cord. You can see the lateral cord and the medial cord. In order to get a nice block for this, you'd want to deposit your local anesthesia below the posterior cord. And usually there's a nice pop once you get in there. But this is not a block for beginners. So we just finished talking about the infraclavicular block, and as you saw, it was a little bit challenging to imagine doing that in a child. One of the blocks that you can do instead of an infraclavicular block is a supraclavicular block, and I'm going to use the linear probe. The surgeries that we use this for at HSS, even in children, we'll use this for hand surgery if we don't want to do the infraclavicular block. But in addition to that, you can use this for shoulder surgery. If you're doing a teenager or a young child who needs a shoulder surgery, you can do a supraclavicular. The position of this can be two ways. You can do it supine like we're showing it here. You can also sit the patient up a little bit. So let me show you this block. This block is much easier for hand surgery in a child than an infra. And as you can see here, you have a beautiful image of her subclavian artery. And you can see the plexus is just lateral to it. One of the things I'd like you to do is to look at the side of the screen. The depth is not even a centimeter. So there's two different thoughts on where you can deposit your local. Some people go on the top of the artery. Some people go beneath it. Either way works for hand surgery. In children, the spread is going to go everywhere, so you don't need to pick a favorite. You should do the one that's easier for your patient. So this is a nice alternative to an infraclavicular. You do still need to worry about pneumothorax and other structures like the vessels, but it's a lot easier to see your needle here and also to manipulate the probe. So the other way that you can do a supraclavicular block in a child, and you can do this for adults too, is in the seated position. And a lot of the surgeries that require a supraclavicular peripheral nerve block are going to be in a beach chair position. It's actually a very nice way to get good visualization of all the structures. So as you can see, the patient or our model Trinity, she's sitting up. I'm putting the probe directly on top of the clavicle. And if you need to, Trinity, can you turn your head to the right a little bit? You can turn the patient's head. Sometimes when you are performing the block, you want to move laterally to see your needle and where the insertion point is. Thank you for joining us. That concludes our tutorial on how to do pediatric regional anesthesia, peripheral nerve blocks on children like Trinity. Thank you very much.